Hello everyone, my name is Charmidale Blanco and I am a student nurse from BSN 111D, and today I am going to demonstrate a health history taking nursing interview. Good morning, ma'am. Allow me to introduce myself first. I am Charmidale Blanco and today I am going to be your student nurse. So, and you are?
Good morning, Mom. I am Irene Grace D. Daniel.
Alright, so is there anything that you want me to call you?
You can call me Eileen.
Alright, Eileen. So, before anything else, I'd like you to verify your personal information. Is that okay?
Yes.
So, your complete name
Yes.
and your age. Okay, so is this your current address
Yes.
and your status? Okay, thank you. Before proceeding to any further, I'd like you to know that in order for me to help you today, I need to ask you various questions regarding your health status, medical background, and also some of your personal circumstances. And so I need your full cooperation. Is that alright, Eileen?
Yes, it's fine.
Okay. So know that your answers will be documented for us to provide you the best care that you can attain. Okay, so is there something bothering you in our communication, Eileen? Like, am I speak too clearly to you?
Yes.
Okay, are you comfortable enough right now?
Yes, I'm very comfortable, Mom.
Awesome. So do you have any questions?
As of the moment, I have no question.
Okay, just feel free to ask some clarification or raise some concerns if there's some. And if none, let us proceed. And so, Eileen, what brings you here today in the hospital?
I came here today because I am suffering from fever and severe colds too.
Okay, so how many days since your fever started?
It's been 2 consecutive days already.
And so, is your colds too?
No, my cold started 4 days ago up to now.
Okay, aside from fever and colds, have you got any other symptoms along with it?
Well, yeah. I have difficulty in breathing that I need to use or open my mouth to grab some air.
Okay, so is your fever and colds got worse at any particular time of the day or night?
Yeah, usually my fever got worse when on night time and my colds got too severe every morning, and before going to sleep, that's when I have difficulty in breathing.
Okay. So, do you still have a sense of smelling?
No.
So your colds, can you describe it for me?
Yeah, it's kind of disturbing because I always sneeze and my nose is very itchy.
Oh, I see. How about the consistency and color of the discharge mucus?
At first, it is just like a watery and clear, but eventually it gets thicker and a yellowish brown.
Alright, so do you have any cough or anything pains in your chest right now?
No, I haven't have one, but it feels like my head is very heavy.
So, do you get headaches every time your fever got worse?
Yes, I got headaches and I feel like I cannot stand it any longer because of the pain.
Okay. So, in a scale of 1 to 10, with 10 is the worst and 1 is the least, can you identify how bad is your headache is?
Well, I suppose it's to be like 7 to 8 whenever my fever got worse also.
Okay, 7 to 8. So, do you feel any pain around your neck and around your head or anywhere in your body?
Well, aside from having headaches and difficulty in breathing, my throat is very sore and it gets very dry.
Okay, so do you have any difficulty in swallowing foods?
Yeah, but only to those very solid foods, but it is fine with smooth foods.
So, how about intaking water and liquid substances?
My throat is fine with it.
Did you take any medications in relieving your health concerns?
Yes, my mom got me some from the pharmacy. It is a paracetamol 500 milligram for my fever and Semdix 500 milligram for my colds 3 times a day.
So, when did you start intaking these medicines?
I am taking it for 3 days now.
Okay. How about some alternative way of relieving the pain?
Well, I did rest my body for quite some time and drink water from time to time.
Okay. So, have you ever been admitted to hospital before and when was it?
Yeah, I've been admitted more like 4 times already. But as far as I remember, the last time was like 2 years ago.
Okay. And what was being diagnosed then?
I've been diagnosed with urinary tract infection.
Okay, so have you been diagnosed with terminal diseases or do you have any other illnesses like cancer, diabetes, or heart problems?
Well, thank God I haven't had one.
Have you been on a surgery before?
No, I haven't.
Okay. So I suppose you do not have any maintenance?
Well, aside from my vitamins prescribed by the doctor, there's none.
Okay. Can I know what kind of vitamin is that?
It is just a vitamin C.
Okay, so do you have any allergies to like food, pets, or even drugs?
Well, for food and drugs, but pets like cats or dogs usually makes me sneeze easy.
Okay, so now, as you said earlier, that you are still single, am I right?
Yes.
But have you been engaged to sexual activity and experienced pregnancy?
No, ma'am.
Okay, does your menstruation normal?
Yes, it is.
Any reproductive problems?
No, there's not.
Okay, so for now, let us proceed to your family history. Do you have siblings?
I'm only child, ma'am.
How about your mom and dad? Are they diagnosed and suffer from diseases?
My dad died due to kidney failure, and my mom is very well now and healthy.
Do you know if one of your family and relatives, like your aunt and uncle, do they have history of conditions like hypertension, cancer, anemia, asthma, diabetes, and heart condition?
Well, my grandma was diagnosed with hypertension and eventually died from an attack. While some of my cousins are asthmatic.
Okay. So, is there left disease that affect you and your family?
I guess there's time.
Okay. So now I'd like to ask you some information about your social background, if it's that okay with you.
Yeah, it's fine.
And if you don't mind, are you working already?
No, I'm still studying.
Okay. Okay, so in what level are you right now?
Well, I'm on the tertiary level now.
Okay, so are you having fun with your studies?
Yes, I am.
How about your relationship with your classmates? Is it good?
Yeah, it is. It's like studying with them.
Okay. Have there been a source of stress to you nowadays?
Well, aside from my studies, there's none since I am surrounded with a nice and very supportive people, especially my family and friends.
Okay. So that's good to hear. So, how frequent have you been hanging out and making good memories with your friends?
Well, when out of school, we do always hang out sometimes in our house or somebody's and been opening up about things.
Okay. And your family?
Well, of course, amidst of hectic days, we can still give time for each of us, especially during weekends where we go out later camping and just some recreational activity with the family.
Okay, that's very nice. And regarding to your current lifestyle, have you done smoking?
Oh, I have
Okay, how about drinking alcohol content beverages?
well, I do, but just occasionally.
Okay, alright, how about your food diet? What are the usual foods that you frequently eat?
Since I am with my family, I got a balanced food every meal and have fast foods once in a while now since I've been through with them already. But when I'm hanging out with my friends, we usually have junk foods and carbonated drinks.
Okay, how about exercise? Did you do body workouts?
Well, I'm not very into exercises, but as an alternative, I walk to school every morning and out.
Oh, well, that's a nice alternative too. But I still encourage you to exercise and even just the simple ones every once in a while. And also incorporate fruits in your diet to boost your immunity.
Okay.
Okay, so now I am done collecting your important data and now I'm gonna sum it up, and if there's error, please feel free to correct me, okay?
Okay.
Okay, and to sum it up, so you are Miss Eileen Grace Denian, a single 19 years old, and you've gone here in the hospital because of your fever started 2 days ago and severe colds for 4 days already. Along with it are symptoms like difficulty in breathing and also an itchy nose, both caused by the severe colds. And there's discharged mucus but no cough and chest pain. However, you have also complained about having a headache whenever the fever got too severe with a pain scale of 7 to 8. Also, a dry and sore throat that made you unable to swallow solid foods but no problem in intaking liquid substances. Is there error so far?
Oh, everything is correct, ma'am.
Okay, so let us continue. So, in order to alleviate the severity of your complaints, you did intake meds, paracetamol 500 milligram and Simdex 500 milligram, both 3 times a day for 3 days already. And for your past health history, you've been admitted 2 years ago due to UTI, and you have not diagnosed with congenital and terminal cases disease. You have only taken vitamin C tablets as a maintenance and no allergies aside from fur pets like dogs and cats. You don't smoke and just drink occasionally. No experience of sexual activities and no known reproductive problems. And in the family, your dad died due to kidney failure and your mom has no known of medical diagnosis, while your grandma is a hypertensive and died from an attack, and some of your cousins are asthmatic. And aside from those illnesses, there's no other known health diseases. And your social activity is good, and so is your mental state. You have a well-balanced diet and body activity. So, is there anything you'd like to correct or clarify?
No, everything's correct, ma'am.
Okay, so now I'd like to get your vital signs and also to listen to your lungs if there's a phlegm formation, and also to your breathing. Is that okay?
Yes, it's alright.
Okay, ma'am, I am going to start taking your vital signs, your temperature, your heart rate, your respiratory rate, and blood pressure. So I'm going to take your blood pressure now. So now allow me to listen to your lungs. Breathe in. Breathe out. Breathe in. Breathe out. Okay, another one. Breathe out. Okay, so okay, ma'am. So your temperature is 38.5 degrees Celsius. Your heart rate is 80 bpm. Your blood pressure is 120/80, and your respiratory rate is 19 bpm. Okay, ma'am. So for now, I am going to send this information that we have covered to the physician in charge of you, and so the physician will furthermore examine you and give you prescription. So please go ahead there and meet the physician. Thank you for your time, ma'am.
Thank you.